So how do we evaluate whether you have a weak heart or not? And the first steps where the concern is going to come is from the history. You're going to say things like, hey, I used to walk this far, but I can't anymore, or I'm getting more short of breath. So that could be a sign of heart failure. Or you can say, hey, whenever I walk, I'm getting chest pains, so I'm getting chest discomfort. That could be a sign of blockage, even an impending heart attack. First steps that we're going to do is when you're in the office, we're going to check an EKG, an electrocardiogram, which lets us know the electrical pattern in the heart. If there are concerns of a heart attack, it can show an impending heart attack. It can show an old heart attack. But we don't rely on that only, because some people can have a normal EKG and still end up having a heart attack to the point where they even need open heart surgery. Next steps would be an echocardiogram. With this, you will likely need to be in the hospital depending on how bad the symptoms are. If they're pretty light, then maybe doing it on an outpatient basis. But if I'm really concerned, EKG, then probably sending them to the ER or admitting them to the hospital for an ultrasound of the heart known as an echocardiogram. Lets us know how well their heart is squeezing. If there's any areas that's not getting enough blood flow, could be an indirect sign of potentially heart damage or heart failure. Another thing is getting testings. A BNP can let us know signs of heart failure. Troponins can be due to heart attacks. And if all of those are basically having a lot of concerns, then we may proceed with an cardiac catheterization, which looks for blockages. If the blockages are significant, then we put stents in. Some people may even need open heart surgery. If no blockages, then we will continue workups as to what's causing your symptoms, especially if the ejection fraction is low.